Yes.
Do you know about back breathing? Which is kind
Yes.
of inhaling your own CO2. Inhaling the expelled CO2,
Can
right?
you explain that to
well,
me?
that would be more rebreathing, no?
Yeah, kind of. It's you have a paper bag.
Oh, okay.
sorry.
Bag breathing.
Yeah.
I thought you said back breathing.
I thought
No.
Yeah, of course. Yes.
Back is back, you know?
Okay, let's
so you're
talk
just
about that.
inhaling your own exhaled CO2.
Well, there's an example. Okay, so I think most people will be aware that if a person was having a panic attack, the instruction at that point was breathe in and out of a brown paper bag.
Yeah,
okay.
I heard that.
What was the purpose of the paper bag? The person having the panic attack was hyperventilating. Because they were breathing too hard and too fast, too much carbon dioxide was leaving the body through the lungs. They were breathing it out. The purpose of the bag was capture the carbon dioxide, rebreathe the carbon dioxide back into the lungs. If you increase CO2 in the lungs, you will increase it in the blood leaving the lungs. This in turn then will increase blood flow to the brain and oxygen delivery, which in turn has a calming effect that neuronal excitability reduces. The brain cell excitability is a really interesting one. Did you know that people with anxiety and panic disorder and depression and mental health problems have increased neuronal excitability? Their brain cells are firing all over the place. And this is not my theory. This has been talked about since 1924. It was known that by rebreathing carbon dioxide into the lungs that it would help to reduce seizures. Mm-hmm. And more recently, a psychiatrist from the United States, Michael Binder, is talking about it. And he's talking about increased neuronal excitability, a paradigm in mental health problems. Now, so the question is, if the brain cells are overly excited, and if that's increasing thought activity, and this kind of comes back to our conversation at the start, I said that mindfulness doesn't work for the very person who needs it the most. Because if the brain is agitated to the point that there's increased neuronal excitability, which in turn is generating so many thoughts, how then can we help to reduce neuronal excitability? And we do that by increasing carbon dioxide. And none of this is new. I wrote a book back in 2010. I was working with 3,000 people with anxiety and panic disorders, specifically. I seen the results that we were getting, and then what I tried to do was bring the science, or at least try and support it in terms of the theory, but what I was seeing practically. And I remember reading a paper by Salyum and Balestrino it was written back in 1988, and they said the brain, by regulating breathing, controls its own excitability. I'd forgotten about it. It's in the book. And then I was listening to Dr. Andrew Huberman talking about it. And he said the exact same quote. So we have to think that we can reduce neuronal excitability. I think that's so vitally important. We have control over our own brain.
What happened in that study with the panic attacks and the anxiety attacks?
Yeah.
So in terms of Binder's paper, so he's putting it out there specifically that people with mental health, he looked at the psychiatric population. 75% of the psychiatric population have either severely or very severely elevated brain cell excitability, in comparison to about 10 to 15% of the normal population.
Which is where the neurons fire.
If the neurons are firing all over the place.
Okay.
And then we have to ask, well, if the neurons are firing all over the place, can we help to reduce that? And it's known, and this comes back to the panic attack. You were talking about breathing in and out of the brown paper bag. Now, by the way, the brown paper bag is not safe if the person continuously breathes in and out. Yes, it is capturing carbon dioxide, but oxygen can't get in.
Yeah, there must be a time limit for the practice, right?
5 breaths or so.
Wow.
But what I would say is, if somebody is having a panic attack, cup your hands. So you simply cup your hands, put them on your face. And the whole objective here is don't breathe fast and shallow, because fast and shallow breathing reduces gas exchange. So if you are having a panic attack,
or oral?
it has to be nose.
Okay.
So hands here. And to breathe silently. Well, you know, if the person is having a panic attack, our objective is to slow down our breathing. So you're breathing in through the nose. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Now what I did there was simply worked at slowing down the respiratory rate from, if it's 20 breaths per minute, down to 10 breaths per minute. Now, if you were feeling lightheaded from doing that, the volume of air that you were breathing in with each breath was just too much, even though you were cupping your hands and pulling carbon
Would
dioxide.
it be an advantage if it's possible for people with a panic attack to slow it down even more instead of the 3, so 5, maybe?
During the part that they are having a panic attack, they're really feeling air hunger.
Yeah.
And if we reduce their breathing too much, the air hunger might just put them into a greater panic. So let's look at that question. When I see people coming into me with panic disorder and I look at their everyday breathing is not good, full stop. Their breathing tends to be noticeable, tends to be upper chest. They often feel they're not getting enough air. Their breath hold time, the Bolt score that we use, is usually low. Not always, but usually low. We know it's reported that 75% of this group have poor breathing patterns. And my objective with that person who is prone to panic disorder is improve their everyday breathing. Don't breathe fast. Don't breathe shallow. Don't breathe hard. Don't breathe mouth. Practice breathing light. So we focus on light breathing first of all. So that's about the biochemical dimension of breathing. We start them off with small breath holds. I have to be very careful with how much of a dose of air hunger I give them. If I give them too much of an air hunger dose, I put them into a panic attack. And the reason being is because every time that they have a panic attack over the years, it has been associated with a feeling of suffocation. Now, when I give them breathing exercises, which are creating that same degree of suffocation, it could bring on a panic attack. So I need to give them a teaspoon of air hunger, but not a bucketful.
So it brings up the trauma that they have. That's nothing to do with the breathing that can put them into the panic attack.
Correct, because they can have a very strong alarm towards the feeling of air hunger. Now, they don't call it air hunger, they call it suffocation. But I want to desensitize their body's reaction to that. So from a psychological point of view, we can help them to train them to be able to cope better with air hunger so that if they feel it then in their normal everyday life, it doesn't trigger the same fear response, which in turn could drive a panic attack. But that's only part of it. I also want that person to be breathing light, slow and low. Nose light, slow, deep. And deep not taking full breaths, but deep just meaning that they've got good recruitment of the diaphragm. I'll typically start with breathing light because we can improve blood flow and oxygen delivery to the brain. Really, really important. Breathing light helps to reduce the chemosensitivity to carbon dioxide. Then their everyday breathing is lighter and slower. That makes them more resilient or helps to bring better balance to the autonomic nervous system, that they're not just teetering on the brink of symptoms. If you have somebody who is prone to anxiety and panic disorder, if that person is breathing a little bit too fast and hard and upper chest all the time, it doesn't take much of a stressor to push them over. Let's get their underlying breathing better. Then they are better able to cope with the challenges of life. So on one aspect, we want to improve their everyday breathing, but on another aspect, if they do have a panic attack, to give them the tools to be able to get themselves out of the panic attack.
Which is this one?
That's one of them. So this one is one. Slow breathing, of course, with that, and ideally low breathing. Now, it's not always easy. If somebody was having a panic, I was giving a course there about 2 weeks ago. One of the gentlemen took a panic attack in the class. I had to go straight to it. Now, this was my first time meeting him, so I had to go just straight to him. Like, I raised my voice to take control of the situation. I got him to cup his hands. I didn't care whether he was breathing this way or this. I just wanted to do two things: cup his hands and slow down the respiratory rate. Because with that, I can pool carbon dioxide when his hands are cupped. And when I slow down the respiratory rate, I can improve gas exchange. So my objective is to get as much blood flow to the brain and oxygen delivery as possible. So then the brain will quieten and that will take him out of his panic. And it did.
But I think it's also related to, of course, that's a physiological thing in lowering your breathing rate to reduce the panic attack, but also, like we talked about earlier, according to the meditation thing, that you are shifting your focus from the panic attack to your breath. Don't you think that?
Yes. So I think your point there is that the fear response with the panic is only going to drive more panic.
I just think that
it's like a vicious circle.
Yeah.
And I would agree with you.
Because I actually regularly have small panic attacks. I suffered 10 years ago from anxiety, and I'm dealing brilliantly with it now. But when I'm flying, for example, and there's turbulence, I can still get these triggers, you know? And as you say, if I control my breathing, comes into a parasympathetic state, it's like this state is controlling my thoughts as well. So the panic thoughts that I had slowly disappears. But whether that's a physiological response or whether the response is because I'm shifting my focus from the panic attack in the flight situation to my breathing.
It's both.
Yeah, I guess so.
Yeah, and it doesn't really matter once it works.
Doesn't it also has
to
do something with, because I mean you have this book, but I mean in yoga, for instance, it's also the coming to terms with the fact that you can't control the plane. Like I get the kind of the same because you can't control it, and when something is out of your control, that's when you can kind of panic. You're like, fuck, I have no control over the situation. And that's when you need it. But that's mental. That's a psychological thing in a way, which can then trigger the panic, which then the breathing then enforces the panic, which then, and that's when it starts. Both ways.
Yeah.
So is it also a mental thing of just like letting go of control and maybe just focusing on the breath? Is that a big part of it as well?
I think there's a couple of things, I think it gets easier with experience.
Yeah.
The more you fly, the easier it becomes. The second thing is...
Doesn't work for me.
Look at the air hostesses.
Look at the what?
Look at the air hostesses.
Stewardess.
So
the
workers.
That helps, definitely.
Yeah, because,
they're so calm.
They're so calm. And I think it can be... Yeah.
Misinterpreted.
But because like I travel a lot, and 15 years ago, of course, turbulence. I don't think anybody likes turbulence, especially if you're kind of just relatively new to travel. But I used to find it was helpful if I looked at their If you have a big problem, you will see it in their faces. But no, they're always calm throughout. I think it's always very important, in terms of having a strategy that works for you. If it works for you, brilliant. And that's the thing about any breathing exercise. There's no one size fits all. But having kind of an overview of the exercises that are doing some specific purpose, and then you choose, well, which one is going to work for me? So you might have some people who are in turbulence, they might do small breath holds. Some people might slow down their breathing to 6 breaths per minute. I typically, if I'm in a situation and I want to bring down my heart rate, I will just take a soft breath in through my nose and a really relaxed, slow, gentle breath out. I don't time it. All I do is just bring a feeling of relaxation to the body.